Okay. Good morning, everyone. Welcome to the first ever Prevention and Action Learning Series that is being organized and hosted by the Southeast Asia Gender-Based Violence Prevention Platform. So we'd like to get to know the people in the room. If you can put in the chat your country, where you're coming from. And our check-in question earlier is the title of your favorite song. So, because we wanted to create a playlist later of your favorite song across the region. So, if you can do that via the chat, and can we go through the housekeeping items first before we have Irene have the video for the welcome remarks? Can we see so a few housekeeping notes. So if you can rename yourselves, that would be great. And then can we now move to the next slide where you have the language translation? Yes, so we have closed caption. And then we have access to the Tetum language translation. And then we also have the Wordly AI translation. So for the Wordly AI, if our colleagues from Dersha can also do the posting of the message in the chat so that everyone can access. If you want to listen to the audio or see the transcription in Lao, Indonesia, Bahasa Indonesia, Malay, Tagalog, Thai, or Vietnamese, please use the Wordly AI. For other languages, you can also use the closed caption, and then we will have the Tetum language translation. Can we get a confirmation that you're able to access the icon with the globe, and you can see English, and then there's the other language option that says Portuguese, but you will not hear Portuguese, you will hear Tetum translation. If we can get a confirmation that everyone is able to access those interpretation arrangements, we can get started. Thank you to the Secretariat platform colleagues who are here. So can you join Lizzie in sharing your favorite song as well? So Lizzie is currently, it's a Timorese band, Clamar. Okay, so if you can put in the chat your favorite song, that would be great. Your name and the country where you're joining us from. Okay, so can I get a confirmation that you're able to access the translation? Thumbs up. Audio, all of you can turn on your audio and video. You can let us know, yes, thumbs up. I see from our Deputy Regional Director, Camp. Who else? Okay, I see some thumbs up from Marami. Okay, and then when you look at the participants list, you will see several names that says Apoy Technico or Tech Support. So all of those individuals will be able to provide technical support to you as we proceed with the learning session. I hope we're okay to proceed. All right. So Irfan, let's go ahead with our opening remarks from our Deputy Regional Director. Sorry, from our Regional Director.
Good morning, good afternoon, and good evening, wherever you're joining us from. It's my great pleasure to welcome you to the very first online session of our Prevention in Action Learning series, hosted by the Southeast Asia Gender Based Violence Prevention Platform. When the platform was first conceptualized, there was a shared recognition that locally driven prevention solutions already exist within our region. What's often missing is space, a space to share them, to learn from one another, and to explore how these practices can be adapted in different community contexts. And that is what this learning series is all about. We are moving beyond the what of prevention and diving deeper into the how, the practical, sometimes challenging, but always essential work of transforming inequitable power dynamics and addressing the root causes of violence. The platform, supported by the Australian government, serves as a regional resource hub. Our aim is to capture, elevate, and share evidence based knowledge on what works to prevent violence, while connecting practitioners, policymakers across Southeast Asia. Under our Facilitate pillar, we are creating spaces like this one, spaces that bring us together to reflect, exchange, and strengthen our shared capacity to prevent gender based violence before it happens. Today's session, Nenamu's multifaceted approach to gender-based violence prevention in Timor-Leste, highlights an inspiring example of community-driven evidence-based prevention. Implemented through the Nabilan program, which is a partnership between the government of Timor-Leste and the Australian government, Nenamu shows what is possible when prevention models are contextually relevant and deeply rooted in local realities. Through this session, we will also provide a short preview of our mentoring program, which will help connect and support gender-based violence prevention practitioners across Southeast Asia. To our colleagues and speakers from Timor-Leste, thank you for sharing your experience and insights with us. And to everyone here today, thank you for being part of this regional community of practice. I hope this session encourages reflection, learning, and collaboration as we continue working together to advance evidence-based, locally led gender-based violence prevention across Southeast Asia. Thank you, and I wish you a meaningful learning session ahead.
Yes. Yay. Thank you so much, Irene. Thank you for your warm welcome remarks. So, good day again to everyone. My name is Pamela Marie Cortez, and I'm the Facilitate Pillar Lead for the Southeast Asia Gender Based Violence Prevention Platform. On behalf of the platform, I'm thrilled to officially welcome you to the very first session of our Prevention in Action learning series. So, as our regional director, Irene, highlighted, this learning series is really all about creating a space to share the how of prevention and learn from the locally driven solutions that already exist in our region. Today's session does exactly that by focusing on an inspiring community-driven example from Timor-Leste. So we have a 90-minute learning journey together. So we'll begin with the foundational overview of the Nabilan program, a partnership between the Australian government and the Timor-Leste government to end violence against women and children in the country. Then we'll move into a panel discussion on Nenamu, an inspiring adaptation of the Stepping Stones model. We're thrilled to have the technical coordinator and the community facilitators to share their on the ground insights. After the panel discussion, we will move directly to our open forum. And this is our space to share our reflections, ask questions, and learn from each other. Finally, we will have some exciting news and introduction to our inaugural cohort of gender based violence prevention mentors. So, We're so happy to have you with us. So let's begin. To start off with an overview of the Nabilan program and introduce Nenamu, I'm delighted to welcome Johanna Paula Shimtadewi, the Nabilan program deputy team leader. Johanna, over to you.
Thank you, Pam. Yeah, hello everyone. I will present about Nabilang program. So we can maybe continue to the slide, please. Yeah, the Nabilang program has been collaboration between Timor Leste and Australian government for over 10 years now. We are currently in the third phase, which through two pillars, we have services and prevention. Which has the objective of ensuring women and children experiencing violence are supported with consistently high quality services, as well as supporting individual, communities, and institutions act to prevent violence against women and children. Next slide, please. So, more than just one program, Nabilang work across all the circle of influence, connecting actors across the EWOW ecosystem in a multi-level, holistic, and system approach. Working with individual, families, communities, leaders, organization, movement, as well as with the political levels. So our partner include the government ministries. There is a women right organization, service provider, as well as other civil society organization that working in addressing violence against women and children and promoting gender equality. This all spanning the prevention response continuum. Next slide, please. Yeah. So this ecological model, including the individual, interpersonal, community, and societal circle of influence, show that some of the risk factor for violence that Nabilang aim to address. So through bringing a critical feminist lens to violence prevention work, we want to see the underlying causes of violence. So we use gender transformative approach, uh, targeting, sorry, next slide, please. Yeah. So through bringing a critical feminist lens to violent prevention work, we want to shift the underlying causes of violence. We used gender transformative approaches, targeting gender norm and unequal power dynamic that sustain violence. Looking to change the negative social norm, focusing on how this change can benefit us all. Uh, Sorry, maybe the last slide, still in the last slide. Yeah. So, in earlier phases of Nabilang, we recognize much of the violent prevention work being funded mostly focused on only one of training and awareness raising, as well as the important work of supporting survivor. While providing essential services to women and children who experience violence is a critical work, we knew this was not sufficient to prevent violence. And also recognizing the diverse partner have a diverse skill, experience, as well as funding. We decided to develop a range of options for partner to use. Uh, yeah, next slide, please. Some we go as long term. Some also the shorter term. But all working to shift social and community norms that perpetuate violence. Yeah. Together with our partner, we have adapted and piloted three evidence-based models. We have Sasa Together, Stepping Stone and Stepping Stone Plus, and the Banda Behero Parenting Program. All those evidence-based model share common core element that we have upheld in the adaptation. So they are transformative, they are interactive, evidence driven, and provide enough exposure over the time. And also they are benefit based and holistic, as well as we uphold always uphold the do no harm approach. Uh, yeah, next slide, please. Yeah. So the Nabilang program is guided by feminist principle. And this also inform on how we approach our partnership. For the most part, our partnership are long-standing. So it's built on the shared value and trust. And with our CSO partner, this include in the critical component of our core funding. Also recognizing that prevention programming is a new programming area for many organizations and needing specific technical skill, experience, and knowledge. So, Nabilang take a working together approach. This include through supporting the well-being, technical capacity of the team, how to engage in the prevention work, and alongside with service provision and acknowledging the challenge nature of confronting violence against women and children. Next slide, please. Uh, Nabilang also prioritizes the effort to build on the knowledge-based evidence to inform the policy and programming through monitoring and evaluation system research, such as support right now support the government for upcoming prevention and propagation study, as well as our adaptation and practice-based learning initiative. And also, sorry, I think can we go back to the last one, please? The slide. Yes, sorry. Yeah. And lastly, our vision and approach on how to scale Nabilang impact and effort is inspired by the principle of feminist scale, which we focus on quality, positive impact, movement strengthening, and also ethical growth. So by this, we may not necessarily scaling up existing intervention, but by the scaling deep to reinforcing Nabilang's own system, as well as creating a ripple effect or scaling out into the wider ecosystem. So I also encouraged anyone who interested in learning about the feminist scale to access the information from the CUSP community of practice down there in the link in this slide. Yeah. So next slide, please. Yeah, thank you. One of the adaptation that I mentioned earlier was from the Stepping Stone and the Stepping Stone Plus model. Together with the originator Salamander Trust, Sifar Urjanda, and the Prevention Collaborative, and also Mary Stop in Timor-Leste, Nabilang adapted this model for the Timor-Leste context. So the program called Neo 9 Bamudansa or Nenamu for short, now being implemented by Estrella Plus Timor-Leste. This is addresses the interrelated challenge of intimate partner violence and sexual, and also reproductive health and right. So it is a gender transformative and participatory learning intervention that aim to support the community members to challenge unequal gender norm and power relation. So, and also realize their sexual and reproductive health rights, and have a healthier and more gender equitable relationship. It does this by working with our four different peer group. So it is separated by gender and age, to using the curriculum with topics on gender inequality and power, safe sex, reproductive health, we have the STI and HIV, sexual right, and also violence against women and healthy relationship. So also the intervention also engage the community leaders to help support effort toward the appropriate response and referral support within the community itself. Healthcare workers and peer support workers and youth activists are also engaged in intensive on the curriculum to contributing to this enabling environment. Thank you, Pam. Back to you.
Thank you so much, Johanna, for that fantastic overview. It's incredibly valuable to understand the full scope of the Nabilan program and also to see how Nenamu fits within that. So you've perfectly set the stage for our panel discussion where we can dive even deeper into the how of the adaptation of the Nenamu. So we have our Nenamu technical coordinator and implementer. So I would like to welcome now our panelists to our virtual stage. So Helio Javier, technical coordinator of the Nabilan program, Natalia De Jesus and Adriano Jimenez, who are both community facilitators of Nenamu. So welcome. Thank you so much for the time and effort. I hope everyone understands that whenever we have a webinar, a learning session, that aside from the time that is put into the actual learning session itself, it takes a lot of preparatory work so that it's something that will be valuable for everyone. So I would like to start with a foundational question. We know that to be able to do gender-based violence prevention work, we must also understand how to respond to cases of violence and support GBV victim survivors. So for Helio, I will direct this question to Helio first. Given that gender-based violence response is essential before starting GBV prevention work, how do you ensure that staff were prepared to safely receive gender-based violence disclosures and that referral pathways were established prior to the Nenamu implementation? So, Helio.
Thanks for the question, Pam. So, hi everyone. So I would like to share with all of you that before starting our prevention work, it's essential to establish the appropriate referral pathways for responding to violence against women and children. I think during the prevention activities and discussing about violence within the community, some participants may recognize that they are experiencing violence themselves. And they might share with their experience with their facilitators and the team members. Not only that, but sometimes prevention work that aims to shift power relation can actually cause unintended consequences, such as backlash from partners or the community members. So it's important to have the referral pathways, proper referral pathways, so that the facilitators or the team members could offer the referral or offer the services to the participants or the community members that came to them and disclose their experience of violence with the facilitators. As a facilitator, what support they could provide when the community members or the participants came to them and disclosed their experience violence to them. So without the clear referral pathways, team members may not know how to give support to the victim survivors when they say they experience violence to the facilitators. We need to be able to support facilitators to understand the step to take if someone disclosed their experience of violence.
Okay.
This is why I think this is why having effective referral process is crucial first step before we begin our prevention initiative. And I think one important thing is we train our community facilitators to handle this disclosure of violence appropriately. As part of Nabilam program, we collaborate with our partners to provide training on responding to disclosure of violence during community discussion, ensuring that all participants feel safe and feel supported throughout the process.
Okay.
Yeah, we also, I would like to emphasize that in that training, we learn about different referral partner organizations, what services they provide. And we also practice using role play with our facilitators to emphasize to facilitators that the importance of privacy and confidentiality and what to say and what not to say when they try to give response to the participant where they come to the facilitator when disclose their violence itself. We also talk about in our discussion with the facilitators, we also talk about where our limitations are. That there are things that we can and shouldn't do, like try to investigate or resolve or provide the counseling. So we leave that up to the specialist.
Yeah, very true.
Yeah. The important thing is we make the person when disclosing to the facilitator feel safe and feel that they are not alone and what happened to them was not okay. So they are feel supported and feel welcome to facilitators for being able to disclose their experience.
Okay. Thank you. Thank you so much.
Yeah, over to you, Pam.
Thank you. That's really incredibly insightful, Helio. So, the importance of establishing those strong safety protocols, reporting protocols, the GBV referral pathways, and the preparedness of the staff, both mentally and emotionally, to be able to receive distressing disclosures of gender-based violence. So before you actually implement a GBV prevention program, it's really a critical and non-negotiable part of our overall work of gender-based violence prevention. So it's the ethical foundation for GBV prevention work. So building on that, let's talk about the program design. We know that Nenamu is an adaptation of a successful model, the Stepping Stones and Stepping Stones Plus. And this is a challenge perhaps that many practitioners face in the field, that how do you take a best practice from another context and then make it truly work for your specific community? So, Helio, could you walk us through that process? How did you adopt this model for the context of Timor Leste? And what are the key elements that you needed to change, to customize, to make it more effective for your communities?
Okay. Before going to respond to that questions, I would like to say that there has been a lot progress globally in developing effective prevention programs, creating demand to adapt these models. But we know when adaptation process are rushed, maybe due to the time, funding, or lack of other resources, the risks becoming ineffective or something even harmful in our intervention. So we wanted to take our time in our experience. We take our time with the adaptation to make sure it will be fit to our context while still maintaining the core components that make it effective. So in the first step was choosing which methodology to adapt. So we looked at our context based on previous research from Nabilan on the rates of intimate partner violence against women. It found that 3 in 5 women of reproductive age have experienced physical and or sexual violence by a male intimate partner at least once in their life. And also, a younger women are at a greater risk of experiencing intimate partner violence. Also, in our context, sexual and reproductive health outcomes also challenging. So the maternal mortality rates are high, contraceptive prevalence are low, and HIV prevalence considered low. However, recent data show HIV rates are increasing. Low rates of condom use and low rates of HIV testing also concern in our context. So based on this context and condition in our country, so we decided to adopt a stepping stone because there was evidence it effectively reduced intimate partner violence, and it closely aligned with our objective around sexual and reproductive health and right. The next step was to get to the curriculum. We organized a 2 week training with experienced stepping stone facilitator from Uganda. They came here and guided us through the core content. As Johanna mentioned before, that training involved Nabilan team members, partner staff, and prevention activists, young people, and representative for LGBTI and sex worker networks. We engage in as activist participants rather than just review the manual or the curriculum, gave us a deeper sense of how the program worked and help us consider necessary beyond just translation. We engage this process immersive made the next step adapting the curriculum. It's also made much smoother. We identify additional topic we want to integrate, such as more content on violence against women and healthy relationship and sexual and reproductive health. We also saw the need for some to enhance focus on participant and facilitator safety, self-care, and referral capacity. And this process also helped us develop our theory of change to guide our revisions. And we spent time modifying the sessions, integrating new material, and practicing delivery with the community group while designing and our tools of the monitoring, evaluation, and framework to shape both the pre-test and pre-test, the curriculum testing, and also the pilot itself. Before launching the full pilot, we conducted a pre-test with two groups of young men, women, including couples, to ensure our adaptation were cohesive, aligning with our TOC, and critically safe for women who were in relationship. We gathered feedback through our observation, interviews, focus group discussion, and the team debrief as well. After analyzing the result, we made final adjustment and moved forward with the pilot. Beyond refining the curriculum, the process taught us a valuable lesson, not just about what to change, but also how to improve our approach to adaptation in the future. We recognize what worked well and what we could do better next time. And importantly, we made the adaptation required for our context while also maintaining the fidelity to the original program to keeping the transformative participatory facilitation and the peer group structure and the progressive sequential structure, the themes, and as well as the same frequency, those contact time with the participants. I think that's all information that I could respond to that question. So over to you, Pam.
Yes, Helio, that's very, very comprehensive and very clear. So it's one, my takeaway is really that it's highly intentional. It's a deliberate process and you take your time and it's a step-by-step process. So as you can recall, what Helio was saying that they actually did their formative research first to be able to understand the nature of the forms of violence against women and girls that are women and children that are happening in their particular community, and that the close linkages between the outcomes of sexual reproductive health and gender-based violence. So they're very much interlinked. And then you can see that they engage the original set of organization and partners who work on putting together stepping stones. So that best practice, so that they were able to have that learning exchange, that training of facilitators. And so it's the way Helio was explaining it, it really highlights that adaptation is a deliberate and a delicate balance between, he was talking about fidelity, which is making sure that the core elements of the model are retained, and at the same time, making it fit for the local realities and where the community members are coming from. So that's very, very important, that delicate balance of fidelity and fit. So, but of course, we know that this adaptation and on-the-ground implementation will generate a lot of lessons learned, right? Things that we can do better the next time around. So it's an iterative process, and that's where the real learning happens. So my next question is for our community facilitators who have been at the heart of this work as well. So for this is for Natalia and Adriano. So could you share with us what were the perhaps the preliminary challenges you faced during the design and then the implementation of Nenamu, and how were you able to address them? So over to you, Adriano, and then Natalia.
Ya. Dia Galatan, desculpa, obrigado by perguntas. no molo katu hatang konaba desafio sira nebe maka ami hasoru durante implemente comunidade e amos hakara katu halo introduce lais konaba organização Estela Ples. Então, atuamos kata organização Estela Ples, hane somos organização ida, nebe makiha Timor Leste, nebe serviço makas, atu hadia qualidade e memórias ho highway Timor Leste, lihusi halo tokasia baiha comunidade sira, nomos instituição sira, onde contribui baiha prevenção, baiha estigma, no discriminação. Nomos Estrela Presmos promove direito e memórias ao highway em Timor Leste. Estrela Presmos mai ho princípio ida nebe maka hakarakatu comunidade sira inclui emo nebe mak moris highway bele iha moris ida nebe maka digno saudável nomos laia violência inclui discriminação. E durante implementa a comunidade, estamos a soro desafio e molok também desafio e essa é a próxima agora round implementa programa baia prevenção primária nebe makita ho Nenamu no hire implementa comunidade está soro desafio sira makanesa e primeiro o insight tu halo adaptação baia curriculum sira tahun dari desafio nebe kita sorumos no sama kita atu uja maneira facilitação tahun esse desafio nebe kita soru tambah liga ho tasona tipos de nerunian maka ita se la uja facilita hanesan mestre alunos mas be ita se uja discussão ida nebe maka ativo no participativo ho itania comunidade sira, participantes sira, e estamos oferece pahak nebe ho itania belo participantes sira, atrune siramos belecente, hola parte kalius e discussão siramos. No, idanemos sa sambot ho ida Miami, Miami jornada Morris nian, may be diak tamba antes ne, amimos hola parte hanesan participante, iha treinamento Nenamu nian, ami bele hare oisa bele iha maneira na tong, atu facilita sessão sira. E molo katu saya hanesan festador, ami mos falar parte primeiro, hanesan co-festador sira, prina pating acompanha festador sira, atu hare maneira sira nomos atu haklian conhecimento e oisa atu explora no desafia participantes siranya Hanoi nomos ideia sira. Ya, por cima mana nisi aumenta participando, eritia susila mita.
Okay. Apologies for that. I know, Adriano, you're sharing incredible things. It's just that Manamimi has a kind of a weak signal, so the English translation is not so clear. So, but can we try again with Natalia? So it's essentially the same question, and if you can share your experience in addition to what Adriano mentioned earlier.
Tiak. Nessa uhing ligo desafio nebe faheona ligo experiencia. Então, antes não adre fahe konaba desafio, não adre introduzo lo konaba Estrela Place. Então, Estrela Place nera asik. Nessa organização de nebe serviço atu hadia qualidade e memórias o highway a Timor-Leste. Lihusi halo advocacia, podi halakong stigma no diskriminação. no promover direito e memória só haibe. Yeah. Então, idane maka uma introdução bada com a organização, no husi desafio será bem hasoro, maka participante balon se sente moe atau kuliah com a tópico será bem ligado ao saúde sexual não reprodutiva. No ensa usa kondom hololos. Tamba se considera ne hanesan tabu. Então, maneira nebe ami halo atau sira belativo maka hahu ho jogo sira nebe amigável. Nomos reconhece sira ni sentimento kata moene normal. Nomos explica con ba benefício se sira kuliah na cloque con ba assunto ne. Se ajuda sira compreende assunto ne dieclio. No sempre respeito sira ni sentimento no decisão. Atu participa iha kurso ne kalai, ka diskusão ne kalai. Além de ne, iha currículo Nenamu, iha sasang lubu kida italiu tiha makventama ba iha sasang sensitivo sirane. Objetivo kata ita hari conexão, toma malolosona, no iha espaço nebe seguro, makafai kuliah kona ba assunto sirane be sensitivo. Amimos halo diskusão sirane iha fatin ketak-ketak entre afeto romane. Amimos estabelece compromisso e início. Hanesang lazulga, respeito uma ideia, não mostrar confidencial. Hodibela ajuda sira tu sente fiarang, amimos usa maneira desenha mapai sin lolong, do que sira kuliah direita. Hodi hameno sirne sentimento moe, atu kuliah kona basunto ne. Hirak nemos ajuda sira, o insatu bela sente confortável liu. Hodi kuliah kona basunto hirak ne. How na idane maka resposta bada ko si Hal.
Okay. Thank you, Natalia. Thank you, Adriano. Just for the benefit of us, the audience, who, because of the signal coming from the side of Mama Mini, Lizzie, is it possible for you to just provide a summary, if you can capture what Adriano and Natalia articulated in their respective interventions?
Sure, Pam. And just to say, I was on the English channel for Mount Adriano, so I didn't.
You're getting a lot of applause and hearts. I wish I could speak and understand Tetum at this point. Lizzie or Helio, from your end, if you can just provide us a quick summary of the intervention coming from Adriano and Natalia.
Can you hear me, Pam? Hi, Pam. Can you hear me?
Yes, yes.
Sorry, I wasn't in the channel to hear Mauna Adriano, but I know that he was introducing his organization. And then Mana Lia was really talking about the challenge that they experience with some of the sensitive topics that are often discussed in the curriculum, and that for some people, talking about sex or talking about violence can sometimes be taboo. And so she was sharing some of the ways that they try to allow people to feel more comfortable to talk about some of these sensitive topics, such as having different groups, women and men in separate groups, also making sure there's lots of games and things that can alleviate some of that shyness for people. And also in terms of really establishing a safe space and reminding participants each time that people come together, the agreements that they've made for how they're going to respect each other's views and not judge each other and things like that, that create a safe space that allow people to share on some of those sensitive topics.
Thank you, Lizzie. Thank you so much. And thank you, Natalia and Adriano, for the expressing those challenges when it comes to, I think across Southeast Asia region, there is really that taboo when it comes to discussing very sensitive topics. And it really takes a lot of effort to be able to create that safe space for the participants to be able to start discussing these sensitive topics. So thank you so much for that. We have one last question for our panelists in relation to the key lessons that you have learned from your experience that will be especially helpful for organizations who are also thinking about engaging in GBV prevention work. So what key lessons have you learned from your experience with Nenamu that you believe would be most valuable for them to learn from? Perhaps we can start with Natalia this time.
Yeah, obrigada, Bara. Você experiência nebe how hetang nobela science and benefício da organização ser selo. Nebe a primeira vez ato continuar então você experiência nebe how hetang bela sai benefício. Primeiro uma precisa MNI, uma monitorização processo, a implementação atividade será. Hanesan hare fila falina lau sesans nian pre no post-test, monitorização no debrief durante a implementa programa. A ligo-se monitorização e também a nota desafio será depois do tempo de brief. A equipe busca solução no bem construtivo para desafio será. No mantém hadiah valor irmai. Halo baklas monitoring atau segura participante no facilitador sirai espaço de nebe seguro. Discussão FGD depois de plantolo no falangneng hode avalia itaninha programa nerasi. No livro CMNI ita aprende kata participante sira kuleo heno selo kona Nenamu. Mas be dalam rumah sida pirang então ita mai ho ideia ida atau desenvolve material comunicação atau ajuda sira halo advokasi aqui que hasirania umang kasirania vizinho no mosirania comunidade. Ita envolve participantes sira doni hodi husu sirene ideia ou se cria conceito no discussão hosira. Kona po insato desenvolve material comunicação hirakne. Envolve sira iha desenvolvimento inclui sirene foto, sirene feedback, ou insato bale construir bem iha material comunicação sirane. Então, tenemos a resposta para que se hau, no vão adressar a menta bot balon.
Yes.
Yeah.
Thank you, Natalia. I heard something about monitoring and communication materials, but over to you, Adriano.
Yeah. Não, semana dia, eu nem posso falar, vamos falar de bem, kami kata di kami membuat kamu selesai aku presida aku implementamos estamos presida soportar pada kita nessa soportar kita dengan terus di teknik kita program kita lalu ya kita presida atau support apastador sira então apastador sira nós precisamos suporta usi equipa técnico sira então mula kata sai apastador sira precisa per etapa sira hodi hola parte di treinamento sira atau ajuda sira mos e inclui prática sessão sira quando se pratica sira nemos atau ajuda sira dele domina topiko na memang kita diskutiamo tu nomos internaliza topiko sira e halo treinamento ba TOT sira depois de halo treinamento TOT ita fem baia fase ida hanesan cofestador então ia cofestador da nemos ita direto sira bela tu facilita sina pati um estado acompanha cofestador sira Atu harena fating maneira sira no tekniko sira atu sai hanesan festador. No hira ya ikus maka ita pensai hanesan festador ba iha programa refere. Então, mula atu sai festador ba iha programa refere, na fating persija tu hetang monitoring usi observação sira atu garante kata festador sira laos de ti habilidade atu domina ka atu tene klian kona ba iha materia sira. Mas vê pensar sira bele refleta pessoal cada tópico sira onde veremos hal transformativos generu baya sira pessoal ka individual referemos e ia ponto selo que me bem ka sente kata que importante mos a organização sira selo importante mos atu halo intervenção e a duração ida nebe maka tempo naru laos duração ida nebe maka o tempo baraka anside tamba usi pratika nebe maka mi halo haturu kata banhira ita halo intervenção o tempo naru maka ita hetang mudança nebe dia clio compara ho intervenção ida nebe maka o tempo bada então ita halo intervenção ia tempo naru né kene belum participante sira ia tempo nebe mak dia pros basira atau bele halo reflexão pessoal atau bele internaliza tópico ka sessão sira pode contribuir para a mudança pessoalnya então gostaríamos de também kata importante teves atau halo intervenção o tempo de nebe mak naru dia kau nai kata kida ne maka responde husi hau ligado ho perguntas nebe mak ya
Okay, thank you so much, Adriano and Natalia. Lizzie, if we can request you to provide a summary again.
Thanks.
You're
Thanks.
receiving claps and hearts. Thank you so much, Natalia and Adriano. But Lizzie, if you can come in before we
Sure.
close this panel discussion and move to the open forum.
Thanks, Pam. So Natalia was sharing, as you mentioned, about the importance of having lots of different types of M&E tools to help the team not only to identify challenges on the go and to debrief to each other, but also in terms of looking for some solutions. And she shared an interesting story about the way that they've used some of the data that they collect in the monitoring and evaluation to develop some communications tools. So they noted that participants were really wanting to share the ideas at home that they were learning, but they might not have felt equipped to.
Okay.
And so the team worked with the
perhaps
community.
Lizzie can come in later. I will. So
Sure.
thank you so much, Natalia, Adriano, and Helio. Is it obrigada, right? Thank you, obrigada. Correct. So thank you so much. That was an incredibly rich discussion. I really wish that I could be able to hear the English translation, but for those who can understand Tetum, you were able to hear the direct on the ground experiences as well as the challenges and lessons learned. And that is exactly what we want to feature in this Prevention in Action Learning series. So I'm sure that has sparked a lot of questions as well as reflections from our fellow practitioners who are part of our audience. So we're now moving into our 30-minute open forum. To guide us through this segment, I'm delighted to hand over to our Senior Project Officer of the Facilitate Pillar, Yin Mar Pu. Over to you, Pu.
Thank you, Pam. Thank you. Hi, everyone. Good morning, good afternoon, everyone, and our panelists and participants. Thank you for taking the time to join us on our very first online prevention in action learning series, our learning journey together. I'm Yima Pu, Senior Project Officer and the Facilitate Pillar Secretariat for Southeast Asia GBV Prevention Platform. Thank you very much to our panelists for this inspiring discussion. We as the audience have learned a lot from your experience and then summarized from the list as well. Thank you very much. So now we open the floor for question and answer sessions. There's a great opportunity for audience and for ourselves to reflect and then ask questions and share the comments. So we encourage you to ask questions and leave the comments in the chat box. Well, actually, I already received the first question in the chat box from the audience about the regular support to provide the facilitators to help them manage gender-based violence disclosures and ensure they receive emotional support. So we already had the panelists. So I would like to invite Natalia to start since you have been directly facilitating the community sessions. So we'd love to hear how you're taking care of yourself and the team. So the question here is, I will rephrase again. Given the sensitive nature of violence against women, facilitation and how some participants, the nature will share the experience of violence either in the group or privately, or when it facilitators, how we or you ensure the well-being of facilitators and to avoid burnout. Over to you, Natalia. Thank you.
Obrigada, Mana. Ah, perguntas furak liga cuidado anglo cuidado coletivo niang. Então, ia minha experiência liga cuidado anglo cuidado coletivo ia equipa facilitador ma que mana bero na bebê experiência moro no todang os participantes era. Então, dia como pensava hari cuidado anglo cuidado coletivo entre equipa. Assegura facilitador de saúde mental dia li husu sentimento e a cara de brief regular, suporte específico cara e precisa. Exemplo, nessa halo referral, no halo treinamento regular com a zero stress. Como esse tempo para retreat niang. A minha organização nos considera idane. Importante também oferece feriado kali, depende da tomba me, hori foti pausa bem hira precisa. Então, idane makaunya respostan ben badak, karek mengadri hebat rumah eventualmente liga ho cuidado coletivo.
Thank you, Natalia. I think maybe Lizzie, can you summarize a little bit quickly?
Hi, can you hear me? Can you hear me?
Yeah, Lizzie. Yeah, thank you.
Okay. Just to summarize very quickly, Manalia was talking about the importance of self and collective care and how the team does that. And she was saying one of the things they do regularly is check in with each other about their how they're feeling about the work. That they are also they do regular trainings in stress management and mental health. They also have good organizational support, and their organization supports them to take leave when they need to, and also go on organizational retreats. So that was some of what she shared.
Thank you so much, Lizzie, and thank you so much, Natalia, for sharing that. Such a powerful reminder of how important self-care and collective care and support for the team and facilitator themselves. Also, I would love to hear the insight from Adriano. So, Adriano, may I invite you to add your reflection from your experience as well? Over to you, Adriano.
Ya. Hoy interrompemos si Manalia, online katakiana iya por balon de macatomentamos. Digado ko pot saya dama kurante na itasoro. Antes ne kami sidau kapar, hoy satu halo ligação entre cuidadoan o serviço de violência nian, que serviço vai a prevenção de violência nian, mas depois de sair nessa prestador, ana soing mana dia ona kata dalam barak maka ita rona itanya belum pasti pantai sira fahe sirna experiência moro notoran sira então idanemos halo itu realita kata banhir telah cuidado coletivo se homos impacto por baixo itania saúde mental incluímos baixo itania fisicamente então se nemos abi consciente kata banhira itania equipa ka individual com satu cuidado zero estresse digo se cuidado ansiramos iremos importância teves com satu bele inclina ka inclui plano idane baiha tenia organização atau tahu importância mos baiha serviço idane atau ne bele garante na pating saúde idane bemak saudável baiha equipa festador sira. No, itu mos tidak dijak kata treinamento hirak na bemak ligado ho zero estrés, hemos sempre confirmado sentimentos sira entre equipa, hemos ajuda tebes kita atau yang sama mantém saudável, no em satu prática ho tenia participantes sira, atau la criamos impacto basira. Então, banheiro está saudável, então nós vamos criar discussão na bem, mas saudável nos banheiros belum participantes sira, não limita nem impacto sira. Amin kata kira nema kau aumenta ligado ho perguntas na bem com a mai.
Thank you, Ariano. I also maybe like emphasize about the quality and self-care that I can hear though, but the translation is a little bit. We have a lot of little bit technical difficulties on interpretation. I'm sorry about that. So I'm sure you share the very insightful that it is but as well. So thank you so much, Ariano. That's I think both of our panelists share the insight that showed how really important self-care, collective care, the strength and the resilience of facilitators when we working so closely with the communities in doing like GBV prevention programming. Thank you so much. So I would like to move to our second question. So I think that will be same to Natalia first, and then after like Adriano. So the Natalia, could you start by sharing what looks like in your day-to-day facilitation work? So the first question is, Natalia, what are some of the ways you prioritize women's safety and mitigate the risk of unintended consequences during the implementation of the Nenamu curriculum? Over to you, Natalia. Thank you.
Ya, obrigada, Bara. Dia dalam primeiro identifica usa atau prioritiza fetos de segurança no mitigação da risco sira, maka lihusi tenia fase teste curriculum no halo piloto. Isso ba a equipa usa tools monitorização e observação. Atau buka hatene se curriculum seguro ba participante feto sira talai. Iha fase sirane. Então, ita aprende kata participante feto sira nebe envolve lahe tambah kelas ka konsekuensi negativo. Então, equipa sente confortável atau continua com a implementação. Equipamos na fating usa tools monitorização, hanesan grupo discussão que entrevista individual, nomos observação, inclui debrief equipa, atau bela identificar risco sira karikiha. Maneira selo atau usa oleh prioritiza feto serania segurança, maka facilita grupo feto ketak, nomani ketak base sensitivo sira. Idane se cria espaço de nebe seguro leu, no for apoio a participante sira, atau fahe serania experiência sensitiva sira. Então, idane maka maneira nebe usa pode priorizar afeto minha segurança no mitigar risco sira. Ya, kare kanesa ne.
Thank you, Natalia. I will over to thank you so much for sharing. And then I will over to Adriano. Could you please share your insights and add some great examples as well? Thank you. Over to you, Adriano.
Ligado com perguntas, lembremos que equipa halomos ou estado da maneira facilitação e lembremos que informado com a trauma sira. Exemplo, anesan pastor sen consciente kata ia feto balon dalam rumah experiência, a sua experiência violência pesado. Então, equipa festador siramos que maneira atu hatene kanota participantes sirane bema precisa. Festador sirania ajuda ka suporta. E festador siramos ia maneira em satu foti pausa Ia momento balu, não sempre for Hanoi vila fali, ba colega participante sira selu, atau Hanoi kona fali ba compromisso nebe ma kita cria antes, atau rai segredo, ka confidencial, nomos, atau assegura kata que informação nebe ma ema pahe, ne saya nessa informação nebe seguro ne lara, atau ema seru presente hanesan, sente hanesan salah wajir pahe dan no, ia parte seluk mos, mas que ita ni objetivo maka ita criona atu desafio norma negativo sira, no ita mos koko tu hal mudança, baia balanço kibit nian, entre feto no mane, maybe banhira ita serviço amuto comane sira, equipa mos assegura tu cria facilitação, ne ho maneira ida nebe maka envolve mane sira, no considera mane sira ne hanesan ita nia belum ka aliado baia mudança nian. Laos considera fali mane sira hanesan emanebe prepetador ka suspeito, mas kita considera belum kamigo baia mudança. No banhira ita envolve mane sira iha maneira transformativo nian, ida nemos hatudu benefício ida nebe maka mudança nebe importante tebes, no ida nemos ajuda atau evita risco baia consequência negativa sira hanesan sira selu kamane selu nebe magdala rumah dadang si programa kala kuhi envolve yang antau maneira ida nebe kita uja hanesan considera sira hanesan belu ka aliado baia mudança mudança nian ka transformativo nian ida nemo ajuda tu limita consequência balu ida nemo ka não responde si hal. Obrigado.
Thank you, Adriano. Thank you for. I think I will summarize a little bit what I can hear so far through English translation. We talk about the trauma-informed approach during the facilitation sessions, and the referral and support services are in place. It makes sure safety and security, and also reduce the risk of an intended risk for the woman and girl as well, and also a great reflection of the power imbalance engagement and why as well. Such a thoughtful reflection and sharing experience, and thank you so much, Adriano and Natalia. I have seen a lot of engaging questions from the chat box, being super interactive, and thank you so much, our audience, for engaging and being understanding the technical difficulty. Thank you so much. So I will go with the second question. So I think I will give this question to Helio. So Helio, there's one question from the audience. So the audience would like to know about the role of religious and community leader during while we are delivering, implementing the Nenamu GBV prevention curriculum. So how do they support this initiative? And then is there any process and great example of how do you engage with the community leaders and faith leaders? Over to you, Helio.
Thank you, Pooh. So we haven't involved religious leader yet in this initiative, but we work closely with the community leaders. So we provide referral training to the community leaders who are often first responder to cases of violence in the community. So when the community leaders aren't equipped with the knowledge of skills to help women experience violence, sometimes I think you all know about that. Sometimes it can be re-victimize them and by blaming them or minimizing their experience. So one of the ways Nenamu tries to ensure the sustainability and work with the local leaders to involve them is provide the training, and we coordinate with the local leaders to implement the initiative in the community itself. So supporting the leaders to respond appropriately to violence against women in their communities, and we also deliver the referral network to their contacts numbers and also the list of the referral networks to them, and also provide training and support to the local leaders. And also in the community event, we also invite them as part of the be own and the responsibility for this initiative in their community, also being role model for the community to be make change in the community. So we have a lot of activities to involve the local leaders in that initiative. So over to you, Po.
Thank you so much, Helio. It's such an inspiring to hear about how the team engaged with the local leaders, and then during the beginning of the very first curriculum and like implementation period. I also like the fact that that you highlight how important to engage with the local leaders and the local authority in the community to it's like something like we support the program and also like initiative and as building the relationship and trust system with the community leader as a very important and I can see very successful program. Thank you so much, Helio, for sharing such insights, and thank you so much, everyone. So I'm very mindful of the timing, and thank you so much for all of our panelists for the reflection. And it is so much wonderful to see so much engagement and interactive from our audience as well. Thank you so much. So with that in mind, I will close our open forum question and answer session here, and then I will hand the session back to Pam for the next part of the program. Thank you everyone for your thoughtful participation. Over to you, Pam.
Thank you. Thank you, Fu, for guiding us through that fantastic discussion. And thank you for all your insightful questions. So we are collating all the questions that you have posted in the chat. We will create a question and answer document that will be included in the recording once it's ready and posted on the Prevention Platform's website. And to address the technical concerns with the translation, we will also include captions when we release the final recording. So again, we appreciate your patience with these technical difficulties. So we have a few more minutes. This is the last part of our learning session. So it's really clear from our conversation and from the work, the great work coming from the Nabilan program, and also the particular intervention that we tackled here today, Nenamu, that yes, primary prevention is still an emerging area of expertise in Southeast Asia, but we are building on a strong existing capacity when it comes to gender-based violence response expertise. So this gives us a solid foundation for undertaking GBV prevention work. So our prevention platform is co-developing, co-creating a set of capacity strengthening strategies to be able to address these capacity gaps. And one of them is what we're calling our GBV prevention mentoring program. So at the outset, our aim is to be able to embed the local capacities by cultivating a small network of national GBV prevention mentors. These mentors will play a vital role in supporting less resource women's rights organizations and CSOs who are keen to start their GBV prevention journey. So our mentors will undergo targeted training on gender-based violence prevention, as well as feminist-informed mentoring. I know Johanna earlier really zeroed in as well on the importance of operationalizing our feminist principles in the way that we do prevention work. So they will eventually be matched with a mentee organization based on their country and their language. And together, each mentor and mentee organization will co-create a tailored plan with clear, actionable goals to guide their relationship. So it's my pleasure to introduce to you the first cohort of the Southeast Asia GBV prevention mentors. So can we, Irfan, can we start with that slide? The next one. So first from Cambodia, I'm delighted to introduce Sakpeya Or. Irfan, if we can move to the next slide. So Sakpeya is a specialist in gender equality, disability, and social inclusion. She has extensive experience integrating these principles into development programs across health, governance, and economic empowerment in Cambodia. She is skilled at translating complex Gen Z frameworks into actionable policies and leads initiatives to prevent gender-based violence, strengthening disability inclusion, and support human trafficking prevention. Sakpeya strongly supports giving women, people with disabilities, and other groups a real voice in the decisions that affect their lives. Next, from Indonesia, please welcome Siti Yunia Masdafia. Siti is the director of the Sabi Amira Women's Crisis Center in Surabaya. She has deep experience in community programs, qualitative research, and supporting groups affected by gender-based violence. While she studied gender and development, she emphasizes that she continues to learn from the community members, from the colleagues, and the young people she works with. She is particularly interested in narrative writing and approaches that build on the strengths that already exist in a community. Okay, from Lao PDR, we have Salakshit Santorn. We call her Nina. So Nina is a project manager at the Gender Development Association of Lao PDR, where she focuses on a violence against women and girls project. Her work centers on promoting awareness of gender and GBV issues and has deepened her familiarity with strengthening justice systems and supporting GBV victim survivors. Throughout her work, she has strengthened the skills of grassroots actors and fostered collaboration to sustain GBV prevention efforts in Lao PDR. Also from Lao PDR, I'd like to introduce Ting Tong Petsabong. So Ting holds a Master of Arts in Southeast Asian Studies. He has gained expertise in national and international programs on women's economic empowerment, ending violence against women and girls, and monitoring of the CEDAW, Convention on the Elimination of All Forms of Discrimination Against Women, monitoring all the CEDAW recommendations, among others. And since 2017, Ting has conducted research on gender issues in Lao PDR and has worked with a variety of stakeholders, Lao government, UN agencies, and CSOs to develop training materials both on gender-based violence and gender mainstreaming. Okay, moving to the Philippines, please welcome Attorney Allen Liberato Espino. Attorney Allen is the founder of Fora Consulting and a member of the National Gender and Development Resource Pool certified by the Philippine Commission on Women. She has done extensive work on GBV, from drafting anti-VAUSI, anti-GBV policies to strengthening support mechanisms for GBV survivors. She has also been involved in major projects like the Gender Fair Media Handbook. And most recently, Allen worked with the Council for the Welfare of Children to develop a guide for media practitioners on the reporting and coverage of children survivors of gender-based violence. Allen is also a fifth-year cancer survivor, so we're so grateful for that good news. Also, from the Philippines, we have Patricia Lauren Tuano, or Lore. Lore is a gender justice advocate committed to advancing women's rights and reimagining power through a feminist lens in the global South. She has worked with policymakers, government agencies, and CSOs to champion inclusive change through advocacy, legislative policy, advocacy, and movement work. So Laura envisions a world that is safe, just, and grounded in feminist care, where dignity is a reality for everyone. And then, next from Timor Leste, we have Helio Javier. We've already had the pleasure of hearing from Helio on our panel discussion. And we're so glad to have him as our prevention mentor. Again, he's a technical coordinator at the Asia Foundation Nabilan program. Helio is passionate about eliminating discrimination against women, children, people with disabilities, and members of the LGBTQIA+ community. In addition to his GBV prevention expertise, Helio has over 10 years of experience and expertise when it comes to sexual and reproductive health. That's why that very close interlinkages of SRH and GBV. Also from Timor Leste, I'm happy to introduce Nivea Saldanha. Nivea is also a technical coordinator at the Asia Foundation Nabelan program, working on the COCOSA program, which is an adaptation of SASA. She provides technical support, mentoring, and training to partners and community leaders to strengthen local capacities for preventing violence against women and children. Her work focuses on promoting gender equality, challenging harmful norms, and supporting community-driven approaches to create lasting social change. Okay, and then we have our last two from Vietnam. Please welcome Associate Professor Dr. Hoang T. Hai Van. So Dr. Van is a senior lecturer and researcher at Hanoi Medical University with a PhD in public health. She leads research and capacity strengthening initiatives on sexual and reproductive health, gender-based violence, and HIV/AIDS across Vietnam. As a mentor, Dr. Van focuses on strengthening the research capacity of Vietnamese scholars on gender-based violence and violence against children. And finally, also from Vietnam, we have Tran Ly Queen Mai. So Mai is a passionate feminist dedicated to building a safe, empowering community for underprivileged women and LGBTQI members and groups in Vietnam. She is a project manager with Association Batik International, where she leads the prevention component of a GBV project empowering university students. Mai also co-founded To Grow, and this is the first young feminist network in the country, and it strives to combat gender-based violence and promote social change through activism. So that's it, everyone. We have our 10 GBV prevention mentors for our inaugural cohort. We will have another round, another call for GBV prevention mentors, but at this time, we are focusing on engaging with them, facilitating exchange of learning, and enhancing expertise when it comes to GBV prevention. So as we close this inaugural session of the GBV Prevention in Action series, I want to leave you with one thought. Today, we traveled all the way to Timor Leste to see how the Nabelan program and Nenamu in particular strive to change harmful norms and at the same time ensuring safety and support for their community facilitators as well as potential GBV victim survivors. So we learned from Johanna, Helio, Natalia, and Adriano that prevention work requires deep listening, careful, intentional adaptation, and the courage to learn and iterate. So that is why this first cohort of GBV prevention mentors aims to build a network of expertise and strengthen the expertise here in our region. So thank you for engaging with us, for your questions, your reflections. The recording and the resources will soon be available on our website. So let's continue to learn from each other, and thank you for being a part of this growing community of prevention practitioners. See you at the next Prevention in Action Learning Series. Obrigada, maraming salamat, terima kasih.